Uh, Originally, this was designed for home telehealth, RPM. But when COVID-19 hit, we also started getting inquiries about how this can be used for in hospitals, especially in nursing homes. This is actually, I don't know if you guys can see my camera still, but this is the exact device that's on the photo. So there's many different versions of it. This is obviously a home version where you just set it and plug it in and away it goes. The idea is, 80% of COVID-19 patients actually can heal without special medical attention. The rest, 15 to 20%, require medication and healthcare. And how do we know? How can we validate hospitalization? Especially a lot of the hospitals today in North America and different parts of the world, if the hospitals are overwhelmed, you can't just say, I have a fever, I want to get tested, I want to get into hospital. So you need to actually have more symptoms such as shortness of breath. The logic is simple. When you have, similar to pneumonia, when you have antibodies fighting against your immune system, it can cause inflammation inside the lungs. So fluids can build up, which means the lungs has less capacity to breathe, which causes shortness of breath. Now, when there's shortness of breath, you're getting less oxygen to your body, which means that your heart senses that less oxygen is being distributed, so it starts pumping faster. So you get two different data sets, which is increase of RHR and respiration rate. Now, we're able to get that at 97% accuracy. And in fact, we're very, very busy these days preparing for the 510K FDA compliance. We have journal publications backing up our claims, and we're doing another clinical trial as another add-on. Oops, if this video was playing here, yeah. So if you look at the video, you'll see the bar going across, that is our stability score. That basically measures the overall body motion. And so what it's doing right now is our algorithm is pinpointing, it's making sure that the body is still, which is important for getting resting heart rate. And it's pinpointing to the vibrational pattern coming from your body, two different sets, one heart and the other chest. So you're getting 74 and 74 right there. If he has a finger cuff, that's not our sensor. That's basically just a comparison with a Nihon Koden medical device. So the number, as you can see, is extremely, extremely accurate. That's one thing that we do. The other thing that we can also, what happened there? Let me just go back. Yeah, okay. So the other thing that we can do, which is not here, is we can also detect cough, the number of cough. We're doing that by looking at the sudden spike of motion coming from the center mass area. And each time you cough, we're going to count. Now, why that's important is in office scenarios as well, or even at home, not many people actually count every time they cough, right? Now, if you're healthy, the studies have been found that 18.6 times a day is normal, coughing, normal. But when you have respiratory disease, you're gonna be coughing around 275 times a day. So there's a big gap there. And we're able to see that specific motion and just continuously count throughout the day. And what's important is you can actually do like 6-hour, 12-hour, 24-hour, 36-hour kind of history map and see if you're getting more and more number of cough. And obviously the RHR and RR numbers. We have apps that can be used and these are apps that can be for like healthcare professionals, of city officials, nurses, family members, whatever it may be. So it can be based on address, it can be based on hotel number, it can be bed number in a hospital situation, or room number. So we can get all that. In the hospital or nursing home, if you look at the image in the background, that bar, the top area, it's basically this case just made black. That's how it's used in an emergency triage type of scenario. So we just plug it in, we have the bar, you just screw it in, plug in, and it's monitoring by the bed number. Why this is important is that you don't need any kind of staff intervention. You don't need patient participation. Like with wearables, someone has to go and say, please put this on properly, don't take it off, blah, blah, blah. And, but with our system, you have 1,000 people coming in, 1,000 people laying on the bed or chair or room, and they're being monitored through that bed. So there's no HIPAA compliance issues here as well, because we're never putting in the actual personal data into the bed number. So that's one thing. We have central dashboards which can be customized. So you can say if it hits a certain number, let's say 120, send me a red alert. Over 100, orange alert, whatever it is. And when you click on that particular information, you get historical graph, as you see in the bottom. So yellow is the average motion, and then you have heart rate, breathing rate, as well as number of cough. Now, the motion, originally, there's been a lot of interest here because from like biopharma companies wanting to know how effective their certain type of drug was. But with COVID-19, this also can kind of illustrate, if they were bedridden, or active and so on. So there's a lot of very important data that we can provide. In the hospital scenario, I mean, this is not, we're not designing this to replace spot checks, but we're designing it so that it can provide, level of stress relief from both physically as well as mentally. A lot of the nursing staff and also doctors are currently undergoing a lot of pressure, and one of the things is maybe I should have checked up on that patient more, right? Because you're seeing people, the vital signs crashing even as fast as 1 or 2 hours. Normally they do spot checks every 4 to 8 hours, but even that's may not be enough. So we can save a lot of time, we can save a lot of redundant work, but at the same time provide a lot of I guess, stress in terms of mental stress. So these are some of the things that we came across. People just passing away or deteriorating very fast. I think this was the main thing. Oh, I keep pressing too fast here. But overall, this is our use case. Again, as a overview, 9 years, 15 engineers, 30 patents, 20 journal publications. We just got another one, so 20.